we recently also opened up a daycare for mothers so that you don't have to choose between having a career and a family. We can concurrently, back in the day, they would tell us work-life balance, but it is impossible. So we are looking at work-life integration to also reduce on carbon emissions, like I mentioned. We use communal transport for our staff. The biggest number of our staff come to work, to and from work using our staff buses.
Hello guys, what do you know about ESG? ESG is environmental, social and governance. This is a new phenomenon that has recently taken over the whole world. With me here in studio is Alison Kapsime. She is the Principal Human Resource and Management Officer who also doubles as the ESG champion at National Medical Stores.
Thanks for having me. My name is Alison Kapsime. As you've mentioned, the Principal Human Resource Management Officer, and I'm also privileged to serve as the ESG Officer, who I serve as a focal point person for all ESG-related matters, a role where I'm supposed to ensure that the policy is implemented, we have a reporting framework, there's awareness, the necessary data is collected, so that at the end of the day, all our operations have ESG considerations in place. So whereas you are saying it's new, something that has actually been here, but maybe the difference is that we are now formalizing it and structuring it into ESG. But these have always been around. If you've heard previously of what they call cross-cutting issues, that's more or less the same thing. Thank you.
I have been hearing a lot of talk about ESG, sustainability, much as you said, it's something that has been here. I have heard about it recently, so it is still very new to me.
Yes.
And maybe other people out there could not be knowing about it.
Okay.
So in simple terms, what is ESG and why is it important for me and other people to know about it?
All right, I'll start with the first part of your question. Yes, it looks like a new phenomenon. And basically, ESG sustainability is a reporting framework under 3 key areas. When you hear the ESG, the E being environment, the S being the social, and then the G being governance. So to take it back to the top, the E, that is the environmental pillar, looks at things like waste management and pollution. You know the impact that pollution has had on our environment. So it's basically looking at how do we reduce pollution into the environment. This can be water, air, and then waste management. How can we responsibly dispose of our waste without impacting the environment or do the least damage to the environment while we are disposing of the waste. The other element is looking at reduction in carbon emissions. The car or whatever mode of transport you're using to go to work, every time you switch on a light, every time you're charging your phone, it's utilizing what? Energy. So it's basically looking at how can we use these resources more efficiently so that even generations to come, your children's children should be able to enjoy these resources that are at our disposal. When you go to social looks at basically the impact of the organization operations on the people or society. And here you look at the different stakeholders just for formatting. I know when you say stakeholders, it looks like a very big thing, but starting right at home, employees, these are very key in every organization out there. How are they being looked after in terms of their wellness? We have labor laws. Are you complying to those? How are you looking out for diversity, inclusion? Is it that you're an organization where every expectant mother has to lose a job? Or are you employing underage children? Which look basic, but they're very important. Look at in our line of work, look at health and safety. Every day people are coming to work, but are they leaving when they are okay? And then is it a kind of workplace where after years of I've been serving here, is the impact of my work that I did for the better part of my life going to make me pay for the rest of my life? Then you look at our clients. Of course, the reason every, I think, business or whatever exists is because of the clients. So when you look at clients, how are you taking care of their interests? That comes to product safety, quality of the service you're delivering. You hear of people talking about customer satisfaction surveys. That comes out to how satisfied are customers or clients with the services or products you're putting out there. So it's no longer um, a case of profit. I'll do anything for profit. So even when you're designing the products, what are the side effects? What are the implications, long-term use, the quality? We also look at suppliers. We tend to forget about suppliers, but you know that we have, for instance, here at NMS, right from the people who offer us outsourced services like cleaning, we need to take care of how we need to be interested in how are they running their business? Are they considering some of these things we take for granted after sweeping, maybe cleaning? Where are they disposing this waste? Is it that they pick the waste and throw it at the road because NMS is now clean? So we also take into consideration some of what we would call supply engagement. Then we also look at community, the community in which we live. And by nature of our services, you know that the community we are talking about basically the whole of Uganda, because we serve public health facilities. So I can't say that this works in only this community. So you'll find somewhere in Ajumani, we have clients, Far East, we have clients, and so on. So in terms of the communities, do you cater for the interests of the community? When you're serving, how are the operations of, say, NMS impacting on these communities? Are we struggling for uh, the resources with these communities? Are we helping the communities in which we operate, or it's to whom it may concern? Then when you go to the G, which is governance, it looks at the leadership. Of course, you know, there's a saying that the fish rots from the top. So if the leadership is not okay, definitely the impact can be seen throughout the entire institution. So the effective leadership, is there a board? What is the oversight role? How actively are they involved? Look at things like risk management. Are we able to stand the test of time? Look at things like the ethical considerations. You've seen even global companies being brought down because they did not do ESG considerations in their work, in their line of work. A scandal breaks out, and then it affects the whole supply chain. When you talk about the ordinary Ugandan, I think what is in it for the Ugandan, why should they be interested? This environmental impact, for instance, it doesn't matter whether you participated in cutting the trees or you were a passive person at the side. When the roads flood, you're all affected. Right now, we can't tell which is the wet season, which is the dry season. Meteorology will predict for us. Tomorrow it will rain, and then it's the sun. So these are things that we need to also contribute. We've talked about waste management in terms of recycling, do away with the single-use plastic. Sometimes I prefer, I shouldn't wash these dishes. Why don't I use a disposable plate, a disposable cup? But all this has an impact. You're in office, basically, they say that corporate institutions are the biggest contributors to paper waste. Do you have to print? Can't you send it as an email? Need you print? Need you print single view, single or back to back? All those are simple considerations that every Ugandan needs to own up. Then when it comes to, say, health and safety, does it mean that because you have a job, you're being paid, you should put your life at risk because you don't have spare parts? If it's your arm today, I don't think you will be able to say, oh, I'll pick another one or another one will grow. So whereas it looks like it's the organizations, at the end of the day, it's the individual. So if they're telling you that these drugs are expired, for instance, in our line of work, and you're going ahead to, you know, to consume them because in your head you're desperate, or people will always say there's extra time from the expiry date or something like that, or they're telling you before you take any medication, please get a prescription from a certified medical practitioner, and you're self-medicating, you're abusing drugs. All these are things that affect the ordinary Ugandan, not that, oh, because ESG, you may not see it in your context in your day-to-day life.
Okay, that was really interesting. You mentioned social impact, having a social impact on your stakeholders. Yes. So I wanted to know which specific interventions is NMS doing at the moment in terms of ESG, and how are they impacting on the community or the stakeholders positively?
Okay. Of course, some of these interventions take a while for their impact to be felt. It's like if I woke up today and planted a tree, for that impact to be felt may take a few years. It will not be felt immediately. So we are trying our best, one, to reduce on energy consumption, or if I can call it the other way around, to ensure that we use energy efficiently. For instance, our head office in Kajansi is now 70% powered by solar. So meaning, I think initially we're using 100% from the national grid, Umeme, meaning that somebody else can now utilize what was initially coming to NMS. The other thing is to also reduce on carbon emissions, like I mentioned. We use communal transport for our staff. The biggest number of our staff come to work, to and from work, using our staff buses. So I believe it looks small, but all those people who would initially be driving to work, to and fro, are using one communal mode of transport, meaning that we are able to save. They may seem like baby steps, but in the long run, we are reducing our carbon footprint. When you look at waste management, we have a sewage treatment plant at Kajansi, our office in Kajansi, which is we've been able to treat water and reuse it for irrigation. Hopefully, when we operationalize our in-house washing bay for our fleet, we'll be able to also use that water more, instead of again going on struggling with the community around Kajansi for the water that is already a scarce commodity today. When you look at the social bit, I told you one of our key stakeholders is our staff. We have invested a lot in staff wellness and welfare. And our staff are these ordinary Ugandans. Sometimes when you're asking about the ordinary Ugandan, we forget that we are also the ordinary Ugandans. These are your sisters, your brothers, your spouses who are working at NMS. So we have a fitness center where we are encouraging staff to go in and improve their physical fitness. You know that one of the things that we are spending on a lot of money in our most of the drugs, when you look at the breakdown, I think from the annual health report, you see that the biggest percentage, some of the biggest consumers are non-communicable diseases. So if we are able to short charge that, what leads to that? They say that sitting is a new cancer today. We are contributing something to the ordinary Ugandan. On the other hand, we also we have regional offices. We have 10 regional offices in Uganda, and each of those offices has regional pharmacists, some depending on the size of the coverage, a bit more. And these have helped us with what we call antimicrobial stewardship, where they ensure that drug misuse is they are sensitizing the communities, the health workers, conducting prescription audits. They are encouraging our community, the people, the general public, please, before you consume any medication, make sure it has been prescribed. Then they're also ensuring that these medicines are kept in the right quality. That we have a cold chain service. Some people in the public may not know, but for instance, vaccines have to be kept at certain temperatures. So if they are not maintained, it means you find that a whole maybe generation is wiped out because the vaccine that they were given was wrong. So they look like small bits, but because of this quality control and assurance mechanisms we have in place, we ensure that whatever product we are taking out to the ordinary Ugandan, like you said, is actually meeting the standards, even the global standards from WHO for us. When it comes to governance, no one would want to be associated with an institution or a head of an institution who is always in the papers, scandal after scandal. Of course, you're losing the credibility as far as public trust is concerned. You recall in the recent past when we were in the middle of the COVID pandemic, there were lockdowns everywhere. It was a global crisis. Supply chains broke down. But we're among because of our robust risk management system, we're able to address all the emergencies that were coming up, were able to supply the essential medicines and health supplies that we are mandated to supply, and at the same time, the emergency orders that came out of COVID. Because you wouldn't tell, for instance, an expectant mother that, please, we cannot get you a mama kit because we are supplying the vaccine somewhere in another region. So we had to find a way to mitigate these risks because we had a very strong system in place. Then we've also been able to reduce paperwork drastically through our ERP, which is dubbed NMS Plus, where we are now doing most of these things that initially had a lot of paper back and forth. Health centers are now able to place their orders online. All that has contributed. It may not look instant, but it has contributed to ensuring that we are incorporating these ESG considerations in our line of day-to-day work.
Thank you so much for that. How do you think other departments in NMS can contribute to having a healthier supply chain?
Okay, we have quite a number of departments, and the supply chain is definitely a joint effort. Everyone has a contribution. So, of course, some of these things, like I mentioned, are being done. Others, there's still room for improvement. Others are just, if I can call them, wishful or still on our wish list. But at least we are somewhere. I'll start selfishly with the human resource department, human resource and administration department. We are currently investing a lot in capacity building. That's through training and capacity building of our staff because of the level of innovation and the need to adapt to the different things that come up. I've just mentioned the ERP. That was a new system that came to replace a previous one. So we had to build capacity internally. And right now, someone who walks through NMS may never realize that there was an old system in place. We've also been able to focus on the wellness of the individual employees. So we are trying to ensure that you're covered financial, health, physically fit, mental health. We have an employee assistance program where staff can have a counselor who can attend to them. There are these things, it could be from work, home, but we have that support service. We recently also opened up a daycare for mothers so that you don't have to choose between having a career and a family. We can concurrently, the whole, back in the day, they tell us work-life balance, but it is impossible. So we are looking at work-life integration. The same way you're expected to pick a call from your supervisor when you're home is the same way you should pick a call from your nanny when you're at work. So those are the things we are trying to make sure that NMS is the preferred employer and we are best placed to attract top talent and retain it. When you look at procurement, we are trying to, as much as possible, ensure that we have sustainable procurement. This is looking at where who are our suppliers. You know that we have a BUBU policy, buy Uganda, build Uganda. So right now, we have 55% of our suppliers being local suppliers. So if there's a local supplier, priority goes to our local supplier, unless maybe something cannot be found on the local market or we don't have the capacity. That's when we shall opt for the foreign, and hopefully this can go even higher, this percentage. And of course, when you buy Uganda, we are creating more opportunities, factories, I don't know, whatever suppliers. Then when you look at ICT, I spoke about the systems in place. It has been able to help us, of course, eliminate the paperwork. The processes are smoother. We are now having harmonized systems compared to initially HR had theirs, finance had theirs, but now we are all onto NMS Plus. And then also the bit of cybersecurity, you know that's the new one of the top risks that everyone globally is facing. So they are able to, handle some of those things. The other department, of course, I wouldn't forget about stores and operations. That's like our, they bring up I think core, that's mandate is procure, store, and distribute, and stores and operations does the storage and the distribution. So the fact that they are able to maintain stock controls so that we are not overstocked or understocked. You can imagine if health facilities are placing orders and then we are telling them, oh, this is not available, you have to wait for maybe 3 months. And then there's also disadvantages in overstocking. It means we are going to hire more space for storage for stock that we do not use. So they make sure that they maintain this at those stock levels. Of course, we have a very large fleet, but we ensure that we buy new fleet, of course, state of the art. I don't know that you've had the privilege to move in one of our rental trucks, refrigerated. We may even be the only ones with them in the country. So those have been able to reduce our average fleet age to 3 years. And then we've also been able to reduce on the maintenance costs. Every time a car is old and every time this is banging, this and the other. We've also been able to we have grown our health and safety culture, of course, through continuous engagements with staff, capacity building, awareness programs. We have daily toolbox meetings for all warehouse staff. You know that you cannot enter any of our warehouses unless you're in proper PPE. And then all the people operating our equipment and fleet are certified. So it's not an area you just go to learn how to drive maybe a forklift. You have to be a licensed operator. When you look at quality control, I told you that we have to make sure that whatever is going out to the public meets the required standard. This is human medicine. There's nothing as precious as life. So these help us ensure that whatever has come in meets the criteria, and then whatever is also going out meets that standard. So you can imagine if you asked for a layman, if you asked for a Panadol and they gave you a green tablet, everyone would be very suspicious. So there's a group of people, a department that is behind the scenes ensuring that they are testing and ensuring that what is supposed to be going to the public for consumption is actually what is there. Then we have quality assurance, a section. These also make sure that we are in line with the regulators. But one of the core rules, I think, which the public may not be aware of, is that they consolidate the collection of medicines, which may, for whatever reason, not be in the right order. You recently heard of an incident of a warehouse a store that got burnt, a district store that got burnt somewhere in the western Uganda. And we had to dispatch a team from quality assurance to go and verify, are the drugs okay? Whatever was damaged was not left there for the public to dispose. They have to collect those and then formally go and incinerate them so that what is not right or fit for consumption has actually been totally eliminated from the process. Someone may ask, but incineration is also difficult. But these are two devils. You're weighing letting these medicines out there. A child will pick a bottle, play around with it, vis-a-vis an incineration where I make sure that because of the high temperatures, everything is totally burnt down. I don't know. Like I said, it's work in progress. I don't know whether I think I've tipped on most of the departments. I may not cover each one of them individually.
Impressive. What I've heard is that NMS is really doing well when it comes to ESG operationalization, and that is really commendable. So now, National Development Plan Clause 4 stresses the importance of government agencies adopting ESG principles in their operations. Why do you think it's important for government agencies or even other organizations to operationalize ESG principles?
Okay. It's a very hard one to sell because unfortunately most of the initiatives need money. It's initially very expensive, but then in the long run, that's when the saving comes in. For instance, if you're to change like the lighting system from the usual to LED, you want to put motion sensors. So I think someone may be listening or watching may wonder, why should I go undergo that expense? But I think the basis is we need a shared value. We found this planet here. It cannot fall apart in our hands. like I mentioned, some of the effects or the things we are suffering. It's very hot. I think of recent, we had the hottest day doing, I don't know, an average of, I think, not less than 37 degrees. So you find that you want to be part of the solution. Yes, make the profit, do whatever you're doing, but can we also ensure that generations to come actually find something? So really off head, if I'm to think in line with NDP 4, I would think you need to an institution that is incorporating ESG into its operations will go a long way in building trust with the citizens. Whereas people say, oh, work for government, you don't have a competitor, but the citizens hold us accountable. So if whatever you're doing, it's either you're going to come out as a scandal or a good story. And I don't think any person would want to be associated with, because you did this, I don't know how many people lost lives because you made a mistake or you didn't consider this, something like that. So for me, I think, one, it will bring in the whole element of trust from the public for whatever service you're offering. And then you also have an opportunity to contribute to the preservation of our environment. For instance, if you're reducing the paper, and sometimes it's not even the big things. You look at things as simple as single-use plastic. Every staff maybe is using a disposable cup, but where does that end up? If you can't do away with the disposable cup, do at least buy the paper cups. You still have, but the paper has a less impact on the environment compared to plastic. Then you also look at the fact that these days, if you've listened right from recent COP29, there's a lot of potential funding for institutions which are what? Which are greening, if I can call it. I think they call it green financing. So if these initiatives I was talking about, some of them seem like very big projects, very expensive, but the development partners are willing to partner with you and cover some of these because they are looking at the bigger picture. I invest a few $1 million here, but in the long run, it's going to conserve or bring better to life. Then you want to attract, we have different generations at the workplace right now, I think maybe 4 or 3, depending. And the younger people are more inclined to institutions that are environmentally or conscious, or somebody will ask, is there a flexi time? Can I remote work? Which were not there in the good old days. Someone knew, I'm out of university, I get my job, work until I retire. But now people are looking at, how is this? So if you're looking to be a top employer, these are some of the things you're going to have to come up with. If people are noticing you're cleaning your offices, you're dumping the rubbish by the roadside. And then we also have this whole social media. People are alert and awake to whatever we are doing and how we are treating people, is there equity pay? Is there gender consideration in the things you're doing? So if you're looking to be a top employer, these are some of the things you're going to have to adopt. Of course, the brand is also very, very important. What are you promoting? We are here saying, oh, we are passionate about the lives of Ugandans, but the things we are doing in-house are not reflected. So these are things that people will hold you accountable to. Yes.
Okay. So in your opinion, what do you think other government organizations can learn from how LNS is integrating ESG?
Okay. I don't think we've reached the point of being the, in quote, subject matter experts, but first start, or if I look at our journey, where we started from and where we are, I think number one, commitment from the top. Leadership is very, very important. We had the board's blessing from WordGo. They constituted a committee that would support or oversee the whole ESG function. Management was brought on board. I'm the person who was appointed myself to be a focal point, because you need leadership commitment. You also need someone to take lead. Otherwise, if every person in the department, in the institution, is looking for how to implement with no clear direction, who is gathering what, who is following up on what, there's need for a dedicated resource for that particular function. I also would advise any institution looking to mainstream ESG to collect data. you need data. The reason why I'm able to talk about we are now using 70% of solar, we've reduced maintenance costs by this percentage is because of data. Where were we before this initiative was undertaken? And where are we now? Otherwise, you'll sometimes the journey seems very long, tiresome, and unrewarding. But when you know where you've come from and you're able to track how you're progressing, I think it's a good way to go. Another thing I would also advise an agency or an institution looking to mainstream ESG is bring the staff on board. Create awareness, capacity building of all stakeholders, actually, the staff, the uh, clients, the communities we are in, the suppliers. Otherwise, it's going to be very unfortunate when you have considerations in place and then a third party supplier ruins it for you. You're seeing that supplier X is using, let me say, forced labor or underage children to produce a certain drug for you, and for you, you're supplying. You wouldn't. So you need to bring everybody on board to and appreciate where you're coming from and why are we, and why this journey is important. Why is this shared value very important for everyone? Yes, those are really the tips I would come up with initially if you're starting, because you also don't want to scare the person starting. Yes.
Okay, thank you so much, Alison. This has been a really insightful conversation, and the year is coming to an end. Any Christmas message for the viewers?
Oh, yes. Christmas is a jolly season, I think. There's a way it has excitement around, but calling upon us to go it with ESG at the back of our minds. And in this particular case, I'll look at let's reduce the waste. Why are you cooking a whole mountain of food for 3 people because it's Christmas? The trolleys are 20 in the supermarket because so we need to look at the 4 hours. Let's reuse, let's reduce, let's recycle, and then reduce what we can. And hopefully everyone can take up individual initiatives to ensure that this planet we are living in is the only one we have. So we need to take care of it. Thank you.
Thank you so much, Alison. It's still a pleasure to host you on this podcast. I have learned so much, and my takeaway is that every small thing that we do can contribute to a healthier environment that our children and our children's children will benefit from. I'm sure I'm going to also be an ambassador for ESG. How about you, our viewers? Let us know in the comment section if you've learned anything and what you're going to do to contribute to a better environment for you and I. Don't forget to like and hit the subscribe button. Ciao.